Think of a region where marketing respects children, where public spaces are free from manipulative ads, and where youth-led content sparks policy conversations. Think of workshops that equip creators with facts and storytelling skills, and of coalitions that turn viral momentum into legislative change.
Healthier diets are not simply a matter of willpower. They are the outcome of systems designed to support people and the planet.
Every individual has a role to play. Share your voice, join a challenge, attend a workshop, or support local advocacy.
When communities, evidence, and policy align,
change becomes inevitable.
This is our shared responsibility. This is Shape Asia.
Welcome everyone. Over to you, Avita.
Welcome again, everyone. I'm Afita of Shape Asia. Thank you for joining us today for our webinar on food labeling for healthier food systems, evidence and policy options in Asia and Africa. We're delighted to have such a diverse group of participants with us. Before we begin, we'd love to get a sense of where everyone is joining from. Please click on the Paul EV link in the chat, or you may scan the QR code and type in your country. You can start now. Can you see the QR code? Okay, there's someone from Malaysia. Okay, I would like us to participate. Okay, Philippines. Many from Philippines here. Some from Indonesia. Australia. From Germany also. That's great. Okay, it's wonderful to see so many countries represented here today. Thank you for sharing where you're joining from. That diversity really reflects the spirit of this conversation, which is about learning across regions and strengthening collaboration. With that, let me ask Dr. Elaine Borazon, Shape Asia's project lead, to briefly introduce Shape Asia and how today's session connects to the broader dialogues happening across Asia and Africa.
Yes, good afternoon, good morning, good evening, everyone. Thank you for joining us here today. So Shape Asia is a regional collaborative learning network that brings together food environment stakeholders across Indonesia, Asia, Thailand, the Philippines, and Sri Lanka to advance equitable and inclusive food policy inclusive food policy solutions. So our vision is to shape an inclusive and healthy food future for Asia together. And our mission is to strengthen food systems and policy environments through collaboration, evidence, and advocacy. And we work around 5 core pillars, which are sustainable food systems, healthy food access, active learning and knowledge exchange, policy and advocacy, for healthier food environments, and education and empowerment to support informed and equitable food choices. So Shape Asia connect research, policy, and practice. And today's webinar on food labeling and nutrient profiling is part of this broader effort. So food labeling plays a key role in supporting consumer decision making. It promotes industry accountability and enables regulatory action, thus making it a critical policy tool for improving diets and addressing malnutrition in all its forms. So while countries across Asia and Africa are at different stages in developing and implementing their FOPL and nutrient profiling models, many of these challenges or the underlying challenges are shared such as, for example, ensuring labels are understood by consumers, addressing equity across income and education groups, responding to industry concerns, and translating policy design into meaningful implementation. So by bringing together experiences from Africa and Asia, this session creates a space for cross-learning across policy pathways from early agenda setting to design and adaptation through to full implementation. So the discussion today will focus primarily on country experiences in Asia, but also reflecting on common insights and lessons that resonate strongly with our partners and colleagues working in African contexts. So through this exchange, we aim not only to deepen technical understanding of food labeling policies, but also to strengthen collective learning and collaboration in support of healthier, more equitable food systems. So we're also delighted to be co-hosting this webinar with two partner organizations, PERGIZI Pangan Indonesia and Food Environments in Transitioning Economies based in Africa. So I'd now like to invite Professor Dr. Ahmad Sulaeman and Dr. Maxwell Mudhara to briefly share their perspectives and introduce their respective organizations.
Prof. Ahmad Sulaeman, are you with us?
Yes, he's there. Professor Sulaeman, over to you.
Okay, thank you very much. Sorry for being late. My signal is bad, so I have to change my laptop. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Good afternoon,
wabarakatuh.
everybody. Maybe they're good. What time in other part of this region? Maybe good morning. Distinguished speakers, policymakers, researchers, development partners, and colleagues from across Asia and Africa. On behalf of Board of Committee PERGIZI Pangan or Indonesian Food and Nutrition Society, it is my honor to welcome you to this webinar entitled Food Labeling for Healthier Food Systems, Evidence and Policy Options in Asia and Africa. We are pleased to co-host this important dialogue together with SHAPE, IDRC, CRDI Canada, and our regional and international partners, reflecting a shared commitment to evidence-informed nutrition and food system policies. As a professional scientific organization, PERGIZI Pangan has long contributed to advancing nutrition science, supporting policy development, and strengthening professional capacity in food and nutrition in Indonesia and the wider region. Food labeling is a strategic policy instrument that sits at the intersection of nutrition science, consumer protection, public health, and food system governance, and therefore requires strong scientific grounding and cross-sector collaboration. Across Asia and Africa, countries are facing a complex and evolving nutrition landscape characterized by the coexistence of undernutrition and diet-related non-communicable diseases. Rapid growth in the availability and consumption of ultra-processed foods, increasing pressure on regulatory systems to protect public health. In this context, front-of-pack labeling and nutrient profiling policies are increasingly recognized as cost-effective population-level intervention to improve diet quality and guide healthier food environments. While global evidence on food labeling is growing, policy translation remains highly context-specific. This webinar is therefore designed as a cross-learning platform between Asia and Africa, enabling exchange of policy experiences across different stages of implementation, comparative reflection on barriers and enabling factors, identification of transferable lessons, and priority evidence gaps. From the perspective of PERGIZI Pangan, today's dialogue aims to first strengthen regional understanding of evidence-based food labeling policies, support countries in navigating technical, political, and institutional challenges, encourage policy coherence between nutrition, food regulation, and consumer protection, and contribute to the development of healthier, more equitable, and more sustainable food systems. With these objectives in mind, I invite all participants to actively engage and enjoy the rich exchange of evidence and perspective throughout today's session. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Professor Dr. Sulaeman and Dr. Mudhara.
My name is Maxwell Mudhara. I'm a professor of agricultural economics at the University of KwaZulu-Natal in South Africa. I'm joining you as part of the FETE, which is Food Environments in Transitioning Economies, which is a group that brings together researchers from Africa and Asia. We've got South Africa in Africa, which is an emerging economy which has got similar characteristics as Malaysia, which is part of our team. And then we've got Tanzania and Ghana. In Ghana, we've got CSIR. In Tanzania, we've got Sokoine University. And in Malaysia, we've got Nottingham University. Here, I'm in South Africa, University of KwaZulu-Natal. Our focus is basically to look at some of the emerging challenges that are caused by the food that we consume, which is, we hypothesize that it's caused by the nature of the exposure of people to different markets and opportunities. So we are looking at the factors that am I okay? I see Elvira is still there. We look at the factors that influence the procurement and also what are the policy implications for that decision. We see that this work that we are doing is very much linked to what we are focusing here today, which is the labeling of food. It is very much an influence on what people do and what people consume, and their awareness is something that we also have an interest in. That's why we found it appropriate for us to join Shape Asia in hosting this webinar, and we hope that it will generate interest and further research going forward. Thank you.
Thank you, Dr. Sulaeman and Dr. Mudhara. Before we proceed to the country presentations, let me briefly situate nutrient profiling models and front-of-pack labeling. A nutrient profiling model, or NPM, is a scientifically defined system that classifies foods according to their nutritional composition, typically based on nutrients of concern, such as sugar, salt, saturated fat, and energy, and sometimes positive nutrients. NPMs are widely used by governments and international agencies as the technical foundation for nutrition policies, including food marketing regulations, school food standards, and front-of-pack labeling. Front-of-pack labeling, or FOPL, translates these technical assessments into simple, visible symbols of food packaging, such as traffic light labels, warning labels, or summary scores to support healthier choices at the point of purchase. Importantly, the evidence shows that FOPL serves as a dual function. It supports consumer decision-making and can incentivize product reformulation by industry. Today's sessions brings together country experiences across these stages to enable cross-learning on how these policy tools function in practice. With that brief overview in mind, we will now turn to our country speakers. Each speaker will have 5 to 7 minutes to share their country experience, focusing on where their country currently sits along the policy pathway, the main policy objective behind approach to food labeling or nutrient profiling, one key challenge encountered, and one lesson that may be useful for others. We will then return to a moderated session to reflect collectively on cross-cutting issues, particularly consumer understanding, equity, considerations, and industry response, drawing connections across the different contexts. Together, these speakers reflect different stages of food labeling policy development. With that, I'm pleased to introduce our 7 speakers. Our first speaker is Dr. Lilian Daniel Kaale, Associate Professor of Food Science and Technology and Director of Innovation and Entrepreneurship at the University of Dar es Salaam, whose work focuses on food nutrition, safety, standards, and regulatory engagement in East Asia. Our second speaker is Professor Dr. Rimbawan, Professor of Community Nutrition at IPB University, Indonesia, with extensive experience in nutrient profiling, nutrition labeling, and national food and nutrition policy advisory roles. Our third speaker is Dr. Sunita Chandorkar, whose research spans food labeling and reformulation, food systems and public health nutrition, and sustainable nutrition using innovative analytical approaches. Our fourth speaker is Mr. Carl Vincent Cabanilla from the Food and Nutrition Research Institute of the Philippines, whose works on food composition and evidence supporting national nutrition and labeling policies. Our fifth speaker is Dr. Michael A. Serafico, a Supervising Science Research Specialist, DOST FNRI, with expertise in nutrition assessment, micronutrients, and food quality research informing public health programs in the Philippines. Our sixth speaker is Dr. Shukri F. Mohammed, research scientist at the African Population and Health Research Center in Kenya, whose work focuses on food environment policies and reducing diet-related non-communicable diseases across Africa. And our seventh speaker is Dr. Nisha Arunatilaka, Director of Research at the Institute of Policy Studies of Sri Lanka, with extensive experience in policy-oriented economic research informing health and social policy. With that, I would like to invite Dr. Kaale to begin. You have 5 to 7 minutes. I will call you when it is already close to 1 minute before 7 minutes. Thank you.
Dr. Kaale, the slides are already
you.
shown on screen. Yeah.
Okay, thank you very much for the invitation. Let me share my PowerPoint.
The PPT is already shown on screen. You just tell me next slide.
Okay, thank you so much. Yes, as it has been introduced by Avita, I'm Lilian Daniel Kaale, Associate Professor at the Department of Food Science and Technology, University of Dar es Salaam. Today, I will present my work on the assessment of the nutrition and market information of packaged food and beverage products available in Tanzania. And this work was carried out in collaboration with the Ministry of Health, University of the Western Cape, and UNICEF. The main idea of this work was to see what is available in terms of, hello?
Yeah, please
Can
go
I
ahead.
Proceed? Okay, yes.
Yes, please go ahead.
Yes. What is available in Tanzania market in terms of packaged food? We collected about 7,000 packaged food across the 3 main regions, which were Dar es Salaam, Arusha, and Zanzibar. And among those 7,000 products, according to what we are using two nutrient profile model. The one of South Africa nutrient front of packaging labeling nutrient profile model, and also WHO Afro to test our data. We just slashed about 28% of the products which didn't have nutritional information or ingredient information. So I will go direct to the policy objective, and the main idea here was to address the rising prevalence of overweight, obesity, and nutrition-related non-communicable in Tanzania. So using nutrient profile models, as I said, we used two of them to identify products high in nutrient to limit or nutrient of concern, which are sugar, saturated fatty, sodium, and non-sugar sweeteners. Moving beyond complex back of pack panels, which is a very obstacle as we speak right now in East Africa, including Tanzania, to interpret the front of pack labeling that simplified decision making. And this was the main objective of carrying this study in order for us to know how many, what is the kind of the labeling do we have in most of these packaged foods. But also, we also focus on the creating a legal basis to restrict marketing, especially for children, and the influx of nutritional poor ultra-processed food, where we managed to assess by using novel specification. So what is current status now as we speak in terms of exploratory and design phase? Extensive market mapping, as I said, 28% of the product were slashed out, and we remain with, out of 7,000, we remain with 5,243 products, which were used now to assess all that parameters which we wanted to assess across Dar es Salaam, Arusha, and Zanzibar, which was provide the baseline data needed for policy justification. So the key findings were like out of these 5,243, 82.1% were ultra-processed food, and we use, as I said, we use novel classification to specify this. So the research has already compared two nutrient profile models, as I said, South Africa front of pack labeling and the WHO Afro nutrient profile model. And we found that more than 90% of the current packaged food in Tanzanian market exceed the limit for nutrient of concern. And currently, nearly, as I said, 1/3 of the product lack basic nutrition panel or ingredient list, indicating a transition is needed from voluntary to mandatory standard. So this is kind of the products which we found in Tanzanian market where they are missing nutrition information or ingredients list, and this is kind of the product which we are slashed out. We didn't manage to use them. So the key constraints is like data gaps and important dependency, as I said, whereby the 28.3% of the product lack sufficient nutritional information, making it difficult for the regulatory officers to monitor compliance. And again, in terms of institutional barrier, high dependence on imported goods, because among the 5,243 products which were assessed, 95 of these products were imported. And this is complicated enforcement, and as the regulations must harmonize now with international trade and regulation standard. High prevalence of non-sugar sweeteners, also with this time, is one of the findings which we obtain often combined with the added sugar, complicated the design of warning labels that accurately reflect the health risk. And one key lesson from our data, or our study, evidence-based advocacy. Let us first speak about the local data. National data, specifically the high percent of ultra-processed food, which is more than 80%, and the child directed market strategies, whereby more than of the product which have been assessed, more than 80% were given this child-directed market strategy. And this is a powerful tool to overcome industry argument that the market is healthy. Again, managing the industry now resistance through transparency, how to create a robust government-led front-of-pack system that cannot be diluted by industry funded voluntary labeling schemes. Because as we speak right now in Tanzania, we are in the process of developing nutrient profile model, and therefore the front of pack labeling which will follow.
Excuse me, Dr.
So,
Paale, can you please
yes?
wrap up?
Yeah. So the last one, where is the implementation stage, anticipating industry and consumer. Note that Tanzania is the exploratory stage, focusing on a preliminary observation. Large importers are beginning to utilize health and nutrition claims, whereby about 33.2% of the product were found to these claims. And the increased awareness among food quality assurance officers regarding the hidden ingredients like non-sugar sweeteners is important, and it was overlooked according to the findings which we obtained. The data suggests that once front of pack labeling is mandatory, 90% of the current market are non-compliant in labels, creating a massive incentive for industrial reformulation. And now the market problem, as I said, is we are really focused to child direct marketing, whereby more than 80% of the product were found out. And the way forward and the recommendation now is comprehensive strategy, move beyond labels to a multi-sector. Mandatory front of pack label is important. Strict nutrient profile model to flag endless imports. As I said, more than 95% were imported. And FICO policy is also mandatory, focus on sugar sweetened beverages. And also the local production incentivize local, less processed alternative to reduce the 90% of the importation. And also we have to educate the population on how to read the new interpretive labels which we are working right now. Thank you so much.
Thank you very much, Dr. Paale.
Yeah, now we have Dr. Rimbawan. You're muted, Dr. Rimbawan. We can't hear you, Professor Rimbawan.
You're still unmute. You're still muted.
Okay, can you hear my voice?
Okay.
Yes.
Okay, yeah. Okay, thank you very much. Good afternoon, good morning, ladies and gentlemen. Thank you to the Shape Asia team for the invitation and also for organizing this important regional platform on healthier food systems. My name is Rimbawan. I'm representing the PERGIZI Pangan Indonesia and also IBB University. This topic actually sits at the intersections between nutrition science, consumer behavior, and also public policy. So for the first slide, as we can see on the screen, in Indonesia over the past decade, obesity has increased substantially among both adults and children, while hypertension and diabetes has emerged as a major public health challenges in Indonesia. And nearly 1/3 of the population consumes sugar, salt, and also fat above the recommendation level, elevating the risk of cardiovascular and also metabolic diseases amid rapidly changing food environment. At the same time, Indonesian consumers often face difficulties in identifying healthier food options at the point of purchase. Although in Indonesia now, back-of-pack nutrition labeling is mandatory, the information provided is frequently complex and less practical for quick decision-making in everyday shopping context. And in this context, the front-of-pack labeling based on nutrient profiling is intended to complement existing labeling system by providing clearer, more visible, and easier to understand nutrition information. Next slide, please. Yeah. Where does Indonesia sit on the policy pathway? Indonesia is currently at the transition phase in the development of front-of-pack labeling policy. At present, BOP nutrition labeling is already mandatory in Indonesia since 2021, but in contrast, for front-of-pack nutrition labeling as implemented through simplified monochrome daily nutrition intake information and also healthier choice logo still remains voluntary in Indonesia. So a fully mandatory nutrient profiling system has not yet been applied across all food products in Indonesia. And to move forward, the government is now harmonizing nutrient profiling based front-of-pack labeling as part of the broader national effort to control the consumptions of sugar, salt, and fat. And these transitions right now is supported by clear policy timeline starting 2024. The legal foundation for sugar, salt, and fat control was established, followed by the introduction of what we call as the Nutri-level grading system in Indonesia. After a period of public consultation, Indonesia is now entering the voluntary adoption phase in 2025 and 2026, and we are expecting that by 2027, it will become mandatory implementation in Indonesia. Overall, this indicates that Indonesia has moved beyond policy exploration and design and is now progressing toward gradual implementations while carefully balancing public health objectives with industry readiness and also considering the economic situation in Indonesia. Next slide, please. Yeah, so far, the most significant barrier has been economic concerns and some resistance from the food industry, combined with political and also coordination challenges in Indonesia. Now, from the industry side, there were concerns about limited early consultation during policy development. There is also concerns on the substantial costs, including label redesigning, reprinting, and also product reformulation. As a result, industry association requested implementation delays and raised concerns about the potential trade impacts. And then at the same time, there are also political challenges in aligning multiple stakeholders. Policymakers must balance public health objectives with economic growth, industry interests, and also trade considerations. In addition, Indonesia also faces technical and institutional constraints and reformulation capability, especially for small and medium-sized enterprises, and also the need to strengthen enforcement and monitoring mechanisms. Taken together, these economic, political, and technical factors explaining why Indonesia is moving forward with a gradual and carefully managed implementation of front-of-pack labeling. Next slide, please.
Prof. Rimbawan, you have 1 minute, please.
Okay. Based on the Indonesia experience, the main recommendation is early and continuous engagement with food industry, beginning with policy design stage rather than the only public consultation. And the engagement helps to reduce resistance and prevents misunderstanding when new regulations are going to be introduced. It will also improve policy design as industry input provide insight, technical feasibility, cost, and also realistic timelines. Next slide, please. And at this stage, Indonesia is still in the pre-implementation phase, with voluntary adoption planned to begin now and mandatory implementation to be started in 2027. As a result, the direct impact remains limited. At the same time, small and medium-sized enterprises may face greater challenges, highlighting the need for technical and financial support during the implementation. Next slide. This is the final slide. Yeah. Indonesia is still at an early stage of implementation, so most visible outcomes are still learning experience from other countries. For consumer, the main effect so far is increasing awareness to the health risks related to high sugar, salt, and fat intake. Over time, when combined with product formulation, it is expected that to help reduce overall intake of sugar, salt, and fat at the population level, and larger impact is expected at industry side. To ensure the policy achieve its goal, Indonesia will need strong monitoring system once mandatory implementation begin to track the compliance, reformulation, and also changes in nutrient intake. Thank you very much for your attention. Back to you.
Thank you very much, Professor Rimbawan. We now have Dr. Sunita.
Am I audible?
Yes.
Yes.
Okay. Thank you so much. Thank you for that wonderful introduction, Dr. Avita, and for this opportunity to present our work on front of packaged nutrition labeling in India. I happen to be an associate professor and into academics and research. I have over 12 years of experience on working on food labeling, analyzing composition of processed packaged foods in our laboratory, and I also happen to be a part of the regulatory, that is the Food Safety Standards Authority of India. I am on their scientific panel on food labeling. Next slide, please. As has been mentioned by previous speakers, even India is undergoing a drastic dietary transition. People are shifting from the minimally processed foods to ultra processed foods that are high in nutrients of concern, namely fat, sugar, and sodium, as we call them, HFSs. They're energy dense but nutrient poor. They have more of nutrient refined carbohydrates, low in fiber and protein content, that has increased the GI of food, that has also lowered the satiety. Because they are ultra processed, they are also source of several synthetic food additives. Though they are hyper palatable and available, affordable, and aggressively marketed, it is leading to excessive consumption of some of these foods. Besides, the other lifestyle factors are therefore leading to increased overweight and obesity, as indicated by the national level data, and as has been mentioned previously by other speakers, increase in pre-diabetes, diabetes, hypertension, abdominal and general obesity, hypercholesterolemia, as indicated by, again, national level data. The cause of concern is essentially these advertisements are targeted at young children and adolescents, and we are seeing pre-diabetes, diabetes, and other metabolic disorders in the younger age group, which used to be in the older age group. Now, this kind of a situation definitely calls for a very strong public health tool, which can be the front of pack labeling, and therefore it is mandatory now, or rather essential, that we bring about front of pack labeling. Next slide, please. Now let us look at what has the journey of India been in the area of front of pack nutrition labeling. Where do we stand? It all started in March 2013 when a panel of experts which was evaluating the school meal suggested that there is a need to strengthen the nutrition labeling and FOPL. We already had nutrition labeling, food labeling on front of pack and back of pack guidelines were there. However, the need was felt to make them even stronger and introduce FOPL. Subsequently, several panels were formed of expert members from the time June 2015 to 2021 January. They deliberated on various issues, identifying gaps, what needs to be done, the constraints for introducing FOPL, and in February 2022, a countrywide study conducted by Indian Institute of Management, Ahmedabad, the survey findings indicated that the HSR model, they suggested SHR as the FOPL model to be adopted, and FSSAI, our labeling team, scientific panel, proposed that Indian nutrition rating, which is adaptation of HSR to suit Indian foods, to be introduced, and this was proposed and the draft regulation was floated in 2022. However, it has not been implemented yet. In December 2025, the 256 report of the Parliament suggested that once again, that there should be a focus on improving readability and consumer understanding of food labels, and implementation of FOPL should take place. Next, please.
Dr. Sunita, you have 2 minutes. Thank you.
Oh, okay. So, a few, as I said, the certain very basic nutrients were essentially put on the food labels. Now it is mandatory to put saturated fat, trans fat, cholesterol, added sugar, sodium, and along with the basic fats. Another important change that has happened is the trans fat limit has been set to 2% in 2022, much ahead of the global targets, and the industries can voluntarily disclose trans fat free logo if the food contains less than 0.2 grams of trans fat per 100 gram. Next slide, please. Okay, so initially the GDA was suggested based on WHO CRO model cutoffs, but subsequently INR was developed. Consumer understanding of FOPL systems, several studies, the key findings indicate that warning labels are better understood. However, IMA Ahmedabad study pointed out at HSR as a better model for use of FOPL. Next, please. Okay, we'll skip this, please. The next one. The next one. Yeah, so the key constraints in adoption of front of pack nutrition labeling in India are essentially a lack of transparent evidence-based nutrient thresholds. India has dietary guidance identifying HFSS foods, but no publicly available evidence or methodology explaining how the cutoffs for fat, sugar, and sodium were derived. WHO CRO cutoffs are available, however, they are not defined for all nutrients across the 17 food categories. There is absence of India-specific epidemiological data, where we do not have countrywide data on dietary intake, which talks about linkages, intake of nutrients of concern and its linkages with obesity, diabetes, hypertension, etc. And the third is absence of clearly defined scientific basis for INR that was proposed. Here, the food was essentially divided into two categories only, solid and liquid, which overlooks the heterogeneity of Indian processed foods with diverse formulations. Secondly, the star rating met with a lot of opposition, because we had stakeholder consultations all through, right from 2013 till recently, including the food manufacturers, consumers, and public health interest groups. And all of them felt that the star rating has a positive connotation only, and it does not take into regard the negative nutrients, and also can offset the positive nutrients that are included in the algorithm. Besides that, long list of exempted food categories has also been suggested. Next, please. Also, there are several forms or sources, multiple sources of nutrients of concern that are present on the food label. These also needed to be taken into consideration while developing the algorithm. Next, please. Yeah, so some of the suggestions for us as well as for other countries which are at this stage is to strengthen the scientific basis of the FOPNL framework. In India, we are trying to, develop the criteria, serving size criteria, expand the food categories beyond just two so that we can capture the diversity of Indian processed foods, define nutrient thresholds using India-specific epidemiological and dietary intake data, conduct consumer studies. And another important point that has emerged from our research is it's not the quantity of fat, but the quality of fat also matters. So some of the sources of fat are essentially at are a higher risk for cardiometabolic disorders, and therefore the source of fat needs to be mentioned on the food labels, as well as we should support for reformulation of foods and encourage the use of healthier fat profiles that are low in atherogenicity and thrombogenicity. So this is in a nutshell where we are and what we need to do. Thank you for this opportunity once again.
Thank you, Dr. Sunita Chandorkar. We will move on to Mr. Carl Cabanilla from the Philippines.
Thank you. Can you hear me?
Yes.
Yes. Okay. Good morning,
Yes,
good
sir.
afternoon, and okay. Uh, good evening to everyone joining from across Asia and Africa. First of all, I'd like to thank the organizer, Shape Asia, for inviting the USFNRI to share its insights on the FOPL development in the Philippines. So I'm in the middle of the panel of speakers, so that means we're at the mid stage of FOPL development. So my title is What Works, for Whom, and Under What Conditions? I may not be able to answer these questions today, but these are important questions that we grappled early on in the development of a new FOPL system in the country. Next slide, please. Okay, before I proceed, some declaration of interest. Next slide, please. Okay, so similar to India and Indonesia before me, the Philippine population suffers from double burden of malnutrition. Stunting remains a problem of public health significance with 24% prevalence for children under 5. And at the same time, the prevalence of overweight and obesity among school children, adolescents, and adults is increasing at an alarming rate. Based on the results of the 2023 National Nutrition Survey, more than 50%, around 57.1% of Filipino adults are overweight or obese based on Asia Pacific BMI classification. And as you know, overweight and obesity are linked to NCDs or non-communicable diseases, and now they are the leading cause of death in the country, with 70% being accounted for 70% of deaths caused by overweight, obesity, and NCDs. Next slide, please. Okay, so because we know, as is also discussed extensively by the previous speakers, unhealthy diet is a risk factor for NCDs. The Food and Nutrition Research Institute, in collaboration with the World Health Organization, Philippine Country Office, initiated the development of a new front-of-pack labeling system for food and beverage products to promote healthy diet in the Philippines. So, can you click on the next one? So, where do we sit right now in the policy pathway? So, in 2000, we started actually the first FOPL when the Food Fortification Act was enacted. So, this was the Sangkap Pinoy Seal program. When a product has a Sangkap Pinoy Seal, it means that the product is fortified with vitamin A, iodine, and iron. And then in 2009, the Nutrition Dietitians Association of the Philippines attempted to introduce a front of pack labeling for nutrients of concern, but this unfortunately materialized. And in 2012, the FDA introduced a voluntary FOPL, which is a GDA type logo, focusing on energy only. And then so since then, there's no other FOPL system that was introduced. Next slide, please. So we're hoping by 2026, we will have our new FOPL system. So what's the policy objective of this new FOPL system? The policy objective, dictates the FOPL format. And there are three possible objectives. Number one is to encourage the consumption of healthy products. Number two would be to discourage the consumption of unhealthy products. And third would be to compare the nutritional quality of the food products. So right now, the articulation of the policy objective is on the part of the government, but this is still subject to the consultation with our technical advisory group. So what I did was to get the policy objective from the Philippine Nutrient Profile Model, which is currently being developed by the Philippine government. And it says that the PNPM is or aims to improve diets and reduce overweight, obesity, and diet-related non-communicable diseases across the life course. Now, I also look at the other government documents, which I found the draft national policy on the promotion of healthy diets, which is drafted by the Department of Health, and it aims to reduce population level consumption of sodium, sugar, and fat for the promotion of healthy diets. Next slide, please.
Mr. Cabanilla, you have 2 minutes. Thank you.
Okay, thank you. Can I skip this one? Yeah, so the development of the FOPL system is guided by the WHO framework manual for front of pack labeling for promoting healthy diet. And I'd like to emphasize that this is government-led. So it consists of 5 steps, and step 1 consists of contextual analysis, followed by the establishment of aim, scope, and principles of the FOPL system. Third step is the stakeholder engagement process. Fourth step is the development of the FOPL system format, which is informed by the development or adaptation of the nutrient profiling criteria, which is being finalized. And then this is also informed by published research on FOPL system performance. And then after developing the system format and design, it is now ready for testing for its performance. And then the developed FOPL system will be ready for endorsement to appropriate government agency for possible policy implementation. Can you click on the next, please? Yeah. So this whole process is being overseen by the Technical Working Group on Overweight and Obesity Prevention and Management, led by the National Nutrition Council, which is the highest policy-making body in the country on nutrition. So right now we are in the stage between steps 2 and 4. So the priority policies of the Philippine Nutrient Profile Model set by the government are marketing regulations, school food standards, front-of-pack labeling, and fiscal measures, including taxation on unhealthy food products. Next slide, please.
Yes, can you please wrap up?
Yeah.
Thank you.
Thank you. So what are the key constraints? In terms of technical, there was limited up-to-date research on nutrient composition of local prepackaged foods, and also consumer understanding on nutrition labeling. We also encountered challenges in developing country-specific nutrient profile model, which we were thinking of adapting whether the PAHO model or the regional models like the SHARO and the WIPRO models. Another source of constraint is that multiple research institutions such as FNRI and other academic institutions are doing parallel studies on FOPL, and we fear that this may result in divergent findings, which could complicate agreement on the final FOPL. Of course, political constraint exists because of concerns over perceived conflict of interest, particularly from the industry actors. And then economic constraint would be resource budget limitations within government, which is common in LMICs. And then lastly, institutional reluctance, especially for the regulators, to adopt new regulations which are perceived as difficult to implement. Next slide. I think, yeah, I'll finish with this slide. One major lesson learned with the ongoing development of the FOPL system in the Philippines is that at the early stage of the process, we need to ensure transparency and meaningful stakeholder engagement. Unclear institutional roles, limited transparency, inconsistent stakeholder consultation can actually hinder progress, as we have seen in the development of the nutrient profile model, which will be discussed by the next speaker. And then it is very important to have coordination among key government agencies and development partners, such as the UN and UNICEF. And the developers should be open to engage with a broad range of stakeholders, including the academe, civil society, and industry, while at the same time safeguarding the integrity of the process. And of course, we need to declare, assess, and manage perceived conflicts of interest among these stakeholders, and also the panel of experts. And with that, thank you for your kind attention.
Thank you very much, Mr. Cabanilla. We would like to invite Dr. Michael Serafico.
You're muted, Dr. Michael.
Yeah, thank you, Elaine. Thank you, Avita. So good afternoon from the Philippines. I'm tasked to share insights in the development of the Philippine Nutrient Profile Model evidences in policy formulation, and opportunities for regional learning and alignment. Next slide, please. So I'll go over the country-specific policy objective of the Philippine Nutrient Profile Model was developed in response to the growing burden of diet-related non-communicable diseases like obesity, diabetes, and hypertension. Our food environment is increasingly filled with highly processed foods, high in sugar, salt, and unhealthy fats. Consumers often lack clear, easy-to-understand guidance when choosing foods. The model provides a science-based way to classify foods by nutritional quality, serving as the backbone for policies like front-of-pack labeling, marketing restrictions to children, and other food environment strategies. Ultimately, the goal is to make healthier choices easier and to push industry towards healthier reformulation. Next slide, please. So the Philippines is currently in the design to early implementation stage. We have reviewed international nutrient profile models and adapted lessons to local conditions. Local dietary intake and food composition data were analyzed to reflect Filipino eating patterns. Consultations with government agencies, researchers, and other stakeholders are ongoing. The nutrient profile model is being positioned to support front-of-pack labeling, restrictions on marketing to children, and broader food environment policies. Next slide, please. So our biggest challenges so far are not just technical, but also institutional and political. On the technical side, food composition and dietary data are incomplete or outdated for some foods, and we constantly balance accuracy with ease of use. Institutionally, coordination across health, trade, industry, and agriculture agencies is complex. Politically and economically, industry has concerns about cost, reformulation, and market impact. The real challenge is translating strong science into a policy that is workable and acceptable. So one major lesson, next slide please, is to put everything in solid science but design policies that can actually work on the ground. Stakeholders, including industry and civil society, should be involved early, but the scientific basis must be protected from being diluted. A key learning need for many countries is how to manage industry resistance through transparent communication of evidence, phased implementation, technical support for reformulation, and consistent government messaging. So what happens after implementation? Experiences from countries that already implemented nutrient profile-based labeling show real industry response. Products are reformulated and healthier variants are introduced. The most visible outcomes are changes in labels, marketing, and product composition, and increasing consumer attention to labels. So what are the implications for the Philippines and the region? So for the Philippines and the ASEAN region, this means that the nutrient profile model can improve both consumers' choices and food supply. Regional learning can help countries share tools, align where possible, and move faster without starting from zero. What are the opportunities then for regional alignment? We have actually shared food systems and trade with regions, similar nutrition challenges and dietary patterns, and cross-border marketing of food products. What are the opportunities for collaboration then? So sharing evidence and methodologies for nutrient profile model development, comparing nutrient thresholds and model structures, joint capacity building, regulatory coherence to reduce industry confusion, and policy resistance. So what does regional alignment can look like? So alignment does not mean identical models. It means shared principles and minimum evidence standards with flexibility for national adaptation based on local health priorities. So I think this is my last slide. Next slide, please. Evidence tells us what works. Regional collaboration helps us make it work better for everyone. So thank you very much and maraming salamat.
Thank you, Dr. Serafico. would like to invite Dr. Shukri Mohammed.
Thank you very much. I hope you can all hear me.
Yes.
Thank you very much for inviting me to this webinar to present work that is ongoing in Kenya and also to learn more about what's going on in Asia. Thank you. So today I'll talk about mainly the nutrient profile model. If you can move to the next slide, yes, and what our journey has been like in Kenya. So the Kenya nutrient profile model was developed to respond to the rising burden of non-communicable diseases. I've seen across all the presentations that have been made today that we're all experiencing this rise in non-communicable diseases. And for Kenya, which is mostly driven by the increased consumption of these ultra-processed food that are high in these nutrients of concern. And so what happens is that consumers are now also not able to make decisions while they're shopping. So that's part of the reason why we developed this nutrient profiling model. It is a standardized document that sort of classifies foods according to their nutrients content. And so we felt the journey for Kenya was we first started looking at developing front of pack labels, but then halfway into the process, we realized we didn't have a nutrient profile model. So we went back and started the development of a nutrient profile model because it sets the thresholds and gives you the classification of the foods for you to be able to have regulatory policies. And so the need for these nutritional related policies included the front of pack labeling, marketing restrictions, and also fiscal policies. Next slide, please. So in Kenya, these are the policies that are under development, and the nutrient profile model was acting as a guide for all these other regulatory policies that you see below, restrictions of marketing of unhealthy foods, fiscal policies, and here we were looking at taxation for sugar-sweetened beverages, then front-of-pack labeling, and then public procurement in public spaces, and particularly in schools. Next slide, please. So this slide shows the current status of these food environment policies. You'd see the dark green is the nutrient profile model, which is already at a completed stage, and the other policies that are coming under the nutrient profile model are the front of pack labeling, which is quite at an advanced stage. The marketing restriction of unhealthy foods to children is also at an advanced stage. Fiscal policies is at a medium stage, and public procurement is a bit in the initial stage. So if you look at where we are on the trajectory of policy development, that's where we are at. So I'll now concentrate more on the nutrient profile model that is complete. Next slide, please. So the key achievement is that Kenya completed its development in 2025, and now that has given a green light to the development of these other policies that are under development. Next slide. The key challenges that we encountered in the development were that, as you've seen, our journey started in about 2020, where we started development of these policies, and it took us that long. But I was humbled to see that in India, its work for FOPL started in 2013, and it's only in 2022 when they started seeing light of that process. So I feel a bit. We thought this was taking too long, but it's good to learn that other countries have even taken longer to develop some of these policies. Other challenges that we encountered was coordination of multiple stakeholders. We had many stakeholders that we needed to bring in from the different ministries that had to be brought on board, and that seemed a bit challenging, particularly when it comes to aligning of, interests of the different ministries that you're bringing on board. You have trade that has other interests compared to health and then nutrition, and we had to bring a lot of different stakeholders on board. One key challenge we encountered was also the presence of industry, which was sort of invited to some of these meetings. And what we observed was that, you know, when we were developing these thresholds, that you could see some of the thresholds being lowered to meet standards of the industry, because they didn't want to reduce some of these thresholds and have their foods later to have labels that, you know, it's high in sugar or high in fat, when looking ahead in terms of when the front of pack labels were going to come out. So one of the key lessons we've learned in this process is that, you know, policy success requires, you know, you needed to have a lot of local data. So we invested as a research organization. We also, through support from IDRC, we invested in also generating evidence to support these policies. So local evidence is very important. Having early and sustained engagement is also another key aspect that needs to be done, particularly with working across multiple ministries and stakeholders. And I think someone else had also mentioned that. Also, the need to have coordinated work plans with all stakeholders, because sometimes there's a lot of duplication of efforts. But if you have key stakeholders that you're working with, it's good to have a coordinated work plan. And then having patience, because it takes a long time to develop these policies. And just making sure you have also coalitions between the researchers, advocacy partners, and the public, because we also need the advocacy partners to create the awareness, and then you also need the public to also understand the work that you're doing. So those are the key lessons that we've learned in this process.
Dr. Mohammed,
some of the observable and emerging impacts that we've observed. Some of these policies are already not in place, the front of pack labeling, but we've seen that the manufacturers have started switching from using sugars and switching to non-sugar sweeteners, and they're already seeing loopholes within our Kenya nutrient profile model, which I really didn't speak much about. It has the nutrients of concern are salt, sugar, fat, and saturated fats. Non-sugar sweeteners was not added, so that's already a gap, and we can already see that some of the foods, the manufacturers are switching to non-sugar sweeteners. So that's somewhere that also needs to be tightened. So for countries that are at the early process of developing the nutrient profile models, I think it's important to also add the presence of non-nutritive sweeteners needs to be identified within the product. And then there's also increased awareness now of the nutrient thresholds from manufacturers, from our regulatory bodies. We are also hearing that there is more manufacturers who are asking about what they need to do or what are the next steps, given that the Kenya nutrient profile model now is in place. And it's guiding front of pack labeling. So it means that manufacturers are already thinking about reformulation and changing their products to probably make them more healthy. In terms of the most visible outcome so far is that it's the Kenya nutrient profile model is now looked at as a reference point for not only labeling, but also marketing restrictions and fiscal policies. There've been quite a bit of movement around fiscal policy taxation in Kenya, particularly around sugar sweetened beverages and unhealthy foods so we can see that awareness is already out there. And so this will improve the regulatory readiness to act on unhealthy food environments. Next slide. I think that's my last slide. Yes, thank you very much.
Thank you very much, Dr. Mohammed. We would like to invite Dr. Nisha Arunatilaka for her presentation.
Hi, thank you, Avita. So I'm going to be talking about the traffic light labeling policy in Sri Lanka. This presentation is based on two papers that we recently published. One is on the evaluating the influence of traffic light labels on consumer sugar sweetened beverage choices. This was using a discrete choice experiment in Sri Lanka. And the other one is Sri Lanka Fiscal Policies and Regulations for Healthy Diets in Sri Lanka. So I've put links for both of those if anyone is interested in looking at them. So the main reason for this policy was that Sri Lanka is facing a very high NCD burden. About 83% of total annual deaths, 70 to 90% of total disease burden is due to NCDs in Sri Lanka. And the main cause for this is one of the main attributes is the unhealthy food habits. So because of that, the main policy objectives were to reduce the NCD risk factors, to curb the high intake of sugar-sweetened beverages associated with the rise of lifestyle-related illnesses in Sri Lanka, and also to educate and empower consumers so that they are able to easily understand the front of packaging information on sugar, salt, and fat content. And it is also third objective is to encourage healthier formulations so that the food available in the market are healthier, and strengthen public health regulations. We can go to the next one. Yes. So the actual gazette implementing the traffic light labeling was in 2016. It was initially only for sugar-sweetened beverages, but the work on that and this gazette was based on an act which was passed in 1980, the Food Act of 1980. So you can see it took 16 years for the traffic light labeling to actually come to light. And throughout this period from 1980 to 2016, various other policies were brought forward which enabled the gazetting of the traffic light labels in 2016. Some of these included empowering the Minister of Health and Food Advisory Committee to make regulations regarding food safety standards and controls in Sri Lanka, and food label regulations that was done in 2005. So all those different policies led to the actual implementation of the traffic light labeling in 2016. And related to that, in 2017, there was a sugar sweetened beverage tax introduced. And in 2020, the initial traffic light labeling was only on sugar sweetened beverages. That was expanded to include salt and fat. And since then also there has been some work done to tighten regulations. Next one, please. So if you look at the key constraints, so this is something that is already implemented in Sri Lanka, but there are certain constraints that is making it not fully effective. So one of the main problem is the awareness among the consumers. So the studies that we did show that only 56% are unaware, and also this awareness change across age, income levels, and education levels. So basically, the young are more aware of it, and then poorer consumers and consumers from low socioeconomic backgrounds are less aware of the traffic light labeling. And also because of industry influence, the milk-based products were not included in this regulation, which is a big problem because that is, as you can see in the graph here, that is one of the products that are most consumed by the consumers. And yeah, so next one, please.
Thank you very much, Dr. Ahmad Sulaeman. Thank you very much for all the speakers for the clear and thoughtful country presentations.
Sorry, Avita, we aren't finished.
Oh, I just have 2 more slides, Avita, sorry.
Oh, okay, sorry.
Sorry. So the key lessons, I think it's very important to properly design and implement the policy to maximize effectiveness. This is a lesson for people who are already developing these policies, and to make sure all relevant products are covered, because otherwise the effectiveness of the policy will go down. and also be prepared already to try to anticipate the types of arguments that the industry might bring in and be prepared to refute those. I mean, these lessons you can learn from other countries that have already implemented these. And very important also to improve consumer awareness. So lastly, how the industry responded to the policy. So initially, actually, the industry did reformulate food so that they can label their the products as healthier. But there was also complaints about the industry that it affected negatively on employment and income effects, especially this was related to fruit-based drinks, and they try to portray that fruit is healthy. So they would use these other claims on the food, health claims, so that consumers will be misguided to consume them, disregarding the healthier labels. I will stop here. Thank you.
All right. Thank you very much, Dr. Arunitalake. Thank you very much for all the speakers for the clear and thoughtful country presentations. We really appreciate you sharing your experiences across different policy contexts. We will now proceed with the moderated discussion. Let's move on to the discussion segment. This discussion will provide an opportunity to reflect across countries on key policy and implementation issues, including consumer understandings of labels, equity considerations, industry response, and evidence gaps across different stages of the policy pathway. To guide the discussion, may I invite Elaine Borazon from Shape Asia to moderate the discussion.
Yeah,
Elaine, over to you.
Yeah, thank you. Thank you again to all our speakers for the rich country perspectives. And for this moderated discussion, I'll structure our conversation by policy stage. So given the platform constraints, I'll begin with the first group and then bring in colleagues from later stages. So I'll start with the speakers from the exploratory and early and design stage to early implementation stage. So Dr. Kaale, Prof. Rimbawan, Dr. Chandorkar, and Mr. Carl Cabanilla. So from your perspectives, which considerations have been most important in shaping policy discussion so far, particularly around consumer understanding, equity, or anticipated industry experience and industry response?
Shall I go first?
Yes, please go ahead, Dr. Sunita. Thank you.
Thank you for that, posing that question. So in India, we have been taking all the stakeholders along. Industry and industry groups have had industry or industrial organizations rather. They're very strong. They have had several rounds of discussions with us. And so as I could not project all the studies, the consumer studies are also there, and we have evidence from consumer studies. The real problem actually lies in having a very diverse food system, diverse food habits, a large unorganized sector which we cannot bring into this, but they are also into micro, small, and medium scale food industries that cannot be at times they do not have business to that level where they can adopt some of these things. So these are some of the issues that I feel are barriers essentially that we have been facing. Industry has been very strong, and when we evaluated the foods that are processed packaged foods that are available in India as of now using the global nutrient profiling models, majority of them scored a very low score, showing that they are not all that healthy. Most of the foods had at least one warning label, high in warning label. That's it from my side now. Thank you.
Yeah, thank you, Dr. Sunita. And would you want to go next? Dr. Carl, Mr. Carl Cabanilla.
Am I audible?
Yes.
Can you hear me? Yeah.
Yes.
Thank you. I think I concur with Dr. Sanita. Building support not just for one particular stakeholders, but a whole range of stakeholders from the civil society. I like to point out the role of civil society, because when you look at the front of pack labeling, successful FOPL formats in the other parts of the world, it was the civil society which really pushed for the implementation of FOPL, particularly on the warning labels in the Latin American side of the world. So I would say really getting the support of civil society is very important. Also with the industry, because they are the ones who will be affected by this policy, and they are very strong, as alluded to by Dr. Sanita. They have very wide resources. And lastly, I would say also the other government agencies. I think another speaker talked about this early on. We have multiple agencies with different mandates. We have the department, for example, FNRI is under the Department of Science and Technology, and our focus really is on product innovation. So how would you reconcile that with, for example, the Department of Health, which pushes for public health, or with the Department of Trade and Industry, which supports our MSMEs? So we really need to get the support of every stakeholders that will be affected by the policy.
Thank you, Mr. Cabanilla. And Professor Rimbawan?
Yes, can you hear my voice?
We can hear you. Thank you.
Okay, thank you. For Indonesia, now I think the most important things about the nutrition education for the consumers, because even though we are going to move to the new FOP labeling system, but we do need, to teach the Indonesian consumers, especially. This is the most important thing, I think. And secondly, I think the way we have to work together with the industry side, this is also important, because it seems to me that right now the food industry are quite happy with the current FOP voluntary ways in Indonesia. We have 2 FOP and the voluntary status now, by using GDA monochrome and also using what we call this as healthier choices. But when we move to the next one with the Nutri-level grade, we call this, most of the industry actually reluctant to start because they have to do the reformulations. And then one more thing, they would like to use the natural artificial sugar. In our regulation, we actually would like industry not to use any artificial sugars. This is the condition in Indonesia. Thank you very much.
Thank you, Dr. Rimbawan. And Dr. Kaale?
Thank you very much. In the side of Tanzania, right now we are under development of the nutrient profile model for Tanzania. And we are make sure that the technical team is contained of all stakeholders, civil society, academia, government agency, which is representing industry, Tanzania Bureau of Standard, etc. However, as far as I can hear also from other presentations, I'm also one of the team member in the Tanzania Bureau of Standard, whereby industry side, when they come to some meetings of discussing some of this nutrient to limit. For example, now they want to replace the sugar with non-sugar sweeteners, and they have big power to insist and to enforce how they can replace the sugar sweeteners. But again, they want also us to combine the two, to accept using the non-sugar sweeteners, but also to add some sugar. So this is a big challenge, as I said, and good enough, the nutrient profile model which we are developing, we didn't include the industry yet. This is government lead process, whereby we are developing the nutrient profile model, and our model is also going to be the non-sugar sweeteners is going to be part of the nutrient profile model in Tanzania is going to be one of the nutrient to limit. We are about to finalize the model, but we didn't use the WHO Afro nutrient profile model. Rather, we are adopting the PAHO, whereby we can see most of the policy areas, they have been covered, where the policy areas which we want to cover, like procurement policy, front of pack labeling policy, market restriction policy, etc. But also this to educate the consumers is something which is also we are real planning to see when we are going to develop our front of pack labeling, which is the policy document, one of the policy areas which we are covering in the nutrient profile model. And for us also, we are expecting to adapt the warning label, whereby we are going to see how we shall develop the scheme. Thank you.
Thank you, Dr. Kaale. And thank you to our first set of discussants. So this is addressed to Dr. Serafico with the nutrient profiling model nearing completion in the Philippines. What has been most critical at this late design stage before moving to implementation?
Actually, we're planning to the final model was already crafted, and the final stage is to present it to stakeholders. So we'll open the draft nutrient profile model for public consultation, and I think that will be the final test of the draft model before we eventually finalize it and present it to the National Nutrition Council Governing Board, for approval.
Yeah, thank you, Dr. Serafico. And this question is addressed to Dr. Shukri Mohammed, being in the early implementation. So how have consumers and industry responded in practice, and what has been most challenging to sustain?
Yeah, thank you for that question. So for us, what we've seen in terms of early response is that for industry, at least we're seeing a bit more there's some form of reformulation that is starting to occur. And they're also asking the regulatory bodies such as Kenya Bureau of Standards, trying to understand what these thresholds mean before the actual front of pack regulations or standards come into place. So that you can see that there's interest among the industry to know what will happen. For the public, what we're seeing is that there's more, you'll see that there's more stories around, awareness of, non-communicable diseases, and that, there's also upcoming policies to tax, say, sugar-sweetened beverages. So there's quite a bit of information. So there's quite a bit of awareness being drummed up through advocacy. So that's what we're seeing currently. But we want to make sure that this work doesn't stop here and continues, even though we do know that policies do take a long time to come to implementation. But we're starting to also monitor the packaged food supply, just to see what the current status is, and then also look into, once these policies are in place, what is changing. So that is actually what we're looking to monitor as well.
Yeah, thank you,
Thank
Dr.
you.
Yeah, thank you, Dr. Mohammed. And I'll turn to Dr. Nisha from a context where both NPM and FOPL are being implemented. So what outcomes have been most visible so far, and what lessons would you highlight for countries earlier in the process?
So in Sri Lanka, we have also seen that there has been product reformulation. So industry is reformulating products in different ways to enable them to move to healthier labels. One of the ways is actually because these are given for ranges. So for example, for sugar, it is if you have less than there are more than 22 grams of sugar for 100 milliliters, it is considered in the red zone. So they bring it just before below 22. So like 21 something. So that is one thing that they're doing. They are also using sugar alternatives also, which are not healthier than sugar. So that is another thing that they're doing. So for people who are still designing policies, I think this is important to cover these spaces. It is also one of the main problems in the policy in Sri Lanka is the lack of coverage, because we have a large informal market which is not covered by these regulations, and also milk products are not regulated. So, and a lot of the beverage consumption is in the milk products. So those are big limitations, I think, that needs to be taken. But also the consumer awareness. I think the country needs to do more to bring more awareness to the consumers, so they know to read these labels and make informed choices. But along with that, we do have a sugar sweetened beverage tax, but it's not effective, because for low consumers from low socioeconomic groups, it is the price that matters the most, not the information, the label. So it is very important to have these taxes high enough so that price is also a deterrent for them from choosing these unhealthy products.
Yeah. Thank you so much. Yeah. Thank you, Dr. Nisha. Thanks to all our discussants. Over to you, Avita.
Thank you, Elaine. And thanks to all our speakers for a rich discussion. We will now move to a comparative reflection. And I'm pleased to invite Dr. Pulasti Amarasinghe of the Institute of Policy Studies of Sri Lanka, an economist by profession, to share his reflection across the country experiences presented today. Dr. Amarasinghe, over to you.
Thank you, Avita, for having me here. So good afternoon, everyone. I'm Pulasti Amarasinghe, and I'll briefly synthesize the cross-country discussions by pulling together the processes, some of the binding challenges, and the lessons that are most transferable in most cross settings. Next slide. This is the way I have tried to synthesize, some of the processes that are happening in the across the countries. One is, at an exploratory stage, the other is design and implementation. And you can argue that, some of the countries should be in some of the other stages. For example, Kenya being an example where, you could argue that it's in early implementation, or Indonesia being late design stages. Given the way I have designed this, so in the exploratory stage, Tanzania is really focusing on building an evidence base for enabling the conditions for government-led front of pack labeling, particularly where data gaps and enforceability capacity can make it quite difficult for them to regulate an import-heavy market. At the design stage, Kenya and of course Philippines and India, they're all working on how to translate this nutrition science into policy tools that are both feasible and defensible, especially in India's case, and also implementable. And Kenya seems to be relatively advanced on the technical backbone with its latest, policy documents, but still has to navigate, the coordination aspects and also the industry pressures, which seems to be common across all the countries. And Philippines is, of course, in the design finalization state and the engagement state, where you can see the emphasis on balancing the scientific rigor and evidence with sort of operational simplicity. And also stakeholder buy-in as well for them. And India shows what happens when a design really becomes contested, in the sense that you have multiple bodies with multiple sorts of evidence, and the core challenge shifts to legitimacy, the transparency of having these different thresholds, the discussions around the threshold as well, and ensuring there's a label format that works for everyone. in the implementation stage, Sri Lanka, of course, shows what happens after rollout. The realities there, especially with awareness, coverage, and equity. In the case of Sri Lanka, especially with the lack of a sustained communication platform to ensure awareness of the traffic light labeling in Sri Lanka. In Indonesia kind of sits in between the design and implementation, very late design stage, where the regulation direction exists, but they're still implementing rules and timelines that needs to be there. Next slide. So what I've tried to do is I've tried to look at the constraints and the transferable lessons from different countries. For Tanzania, the constraint is missing and having this missing and incomplete nutrition information and sort of limited enforcement capacity, especially given the stage, the design stage they're at. The exploratory stage they're at. Some of the most useful lessons are to borrow from maybe the Philippines or Kenya in also building transparent decision rules, and also having this phased rollout as they did in Philippines and also in Kenya, where you have the coalition building tech and coordinated work plans between all these government or agencies to ensure a successful delivery. And for Kenya, the constraints that were discussed were coordination and also industry interference, among other issues. And this industry interference seems to be an issue everywhere. And two helpful lessons really come from Sri Lanka and Philippines, where you have the facing and the support of stakeholders that can commit, and also in Sri Lanka, where you have warnings that really warning lessons from Sri Lanka, where you need effective package in terms of awareness, coverage, and other complementary measures in taxes and other measures to go along with traffic light labeling in Sri Lanka. And in Philippines, the issues are with alignment, agencies aligning with multiple agents working on these to align evidence, and also to kind of have the trade-off between rigor and feasibility. And of course, the Kenya's coalition model works quite well, and India's cautionary model of having if there are thresholds and label formats are not grounded in transparent evidence, then you can have a lot of contestation and a lot of people attacking the policies. And for India, you have the contested thresholds and delays in rule making, and of course there's no front of package labeling yet. And Tanzania's evidence first approach to really look at what's happening out on the shelves, and how different nutrient profiling choices could classify foods, that could be a very useful lesson for India. And also having the Philippines approach of turning science into an operational package with the phase pathway that they showed. Of course, India has taken that approach, but there could be lessons to take from Philippines over there. In Indonesia, of course, you have sequencing issues in the sense that regulation and this the timelines and monitoring, and of course, lobbying issues with the industry as well. And of course, Sri Lanka, given that it is at a later stage, implementation really once again depends on awareness, coverage, and the whole package once again, and complementary policies. And the Philippines also provides a practical lesson with their phase-out plan. For Sri Lanka, I think it's really looking back at what we missed. There are awareness gaps, equity gaps in terms of who's aware of it, who's using this, and who can actually even understand what traffic light labeling is in theory, or in effect, like especially low-income households not being that aware or not being able to use these policies. So having a sustained communication effect, having the other policies stronger, and understanding the local context, especially like they did in other countries, that could be very useful for Sri Lanka. So Elaine and Avita, back to you. Thank you.
Thank you, Dr. Pulasti. We will now open the floor to Q&A. Yeah, let us know if you have questions, and we can we can address to the speaker.
Yeah, thank you very much, Dr. Amara Singh, for that insightful comparative reflection, which helpfully drew together common themes and contrasts across countries and policy stages. Participants are welcome to submit questions through the Q&A box or chat, and we will take 2 questions for now. Can you mention your name, your institution, the question, and to whom it's addressed to? Okay, there's one question from the chat. My name is Ahmad Bayu Aryawan, alumni Faculty Animal Science, Alu Oleh University in Kendari, Indonesia. I would like to ask,
Maybe I can help read, Avita. I would ask my question to all my parents that what is strategy brief of pack labeling used brought to spiritualism strength reside in every country, both of majority or minority perspective. What is the factors for making connection about front of pack labeling and spiritualism? Are created healthy lifestyle with moderated sectors trending in the year. I would ask my questions to all speakers that how the strategy brief of using pack labeling brought to spiritualism are created. Healthy lifestyle. Professor Rimbawan, would you want to address this question?
Sorry, can you repeat the questions because I couldn't hear
what
very
are the factors
clearly.
for what are the factors for making connection about the front of pack labeling and spiritualism to create healthy lifestyle?
Yeah, I think for Indonesia, when we are designing the front of pack labeling, we don't really consider the spiritualisms, but basically what we would like to make sure that the level of especially sugar, salt, and also fat actually following the regulations. Concerns maybe is coming when we are considering fat for Muslim people, for example. Then we have already the regulation, for the halal food, I think. So the concern about this is for the halal food, I think it's already been in place right now. Then we are very strong on it in Indonesia, basically. Thank you very much.
Thank you, Professor Rimbawan. Yeah, over to you, Avita.
Okay, we can take another question. Okay, if there's no more questions, any questions?
We can proceed with the closing and final remarks.
All right.
Okay, so let me now close this session. We want to thank all our co-hosts, speakers, and participants for joining us today and for contributing to such a thoughtful exchange. So the richness of perspective shared across 6 countries and different policy stages reflect exactly what Shape Asia seeks to foster, which is learning together across contexts to strengthen healthier and more equitable food systems. So as a collaborative learning network, Shape Asia is committed not only to dialogue, but also to action. So we would therefore like to invite you to stay engaged with us beyond today's webinar. So we currently have an ongoing youth content challenge, which aims to amplify youth voices and creative ideas around healthier food environments. We encourage you to share this opportunity with your students, young professionals and networks who may be interested. You can also follow and connect with Shape Asia through our Facebook, LinkedIn, and Instagram pages, where we share updates on research, policy dialogues, capacity building activities, and upcoming events across the region. So for those interested in deeper engagement, we also welcome expressions of interests in collaborating with Shape Asia, whether through research, policy work, communications, or regional learning activities. If you would like to explore future collaborations or stay informed about upcoming opportunities, please feel free to reach out to us at shapeasiashape@gmail.com. So once again, thank you for being part of today's discussion and for your continued interest in advancing healthier food environments. We look forward to learning and working together in the months ahead. Thank you very much.
Thank you, Dr.
Thank you very
Elaine.
much. Thank you.
Would like
Thank you.
everybody
Thank
to
you.
stay and open their camera now for photo session.
Right.
Okay, should we start? Okay, 1, 2, 3. Okay, and the next one. 1, 2, 3. Next page. 1, 2, 3. Next one. 1, 2, 3. Okay, I think we've got everybody. Thank you again, everyone. Have a nice day. Have a nice night.
Have a nice evening. Have a nice morning.
Thank you. Bye-bye.
Thank you so much.
Thank
Bye.
you.
Thank you.
Thank you.
Thank you.
Bye-bye.